Hello, everyone, and welcome back to Voices in Health and Wellness. This is the podcast where we sit down with the innovators, practitioners, and founders who are redefining what care looks like today. I'm your host, Dr. Andrew Greenland, and today I'm delighted to be joined by Peter Grinbergs, co-founder of EQL, a pioneering health tech company that's transforming the way musculoskeletal care is delivered. Peter started out in physiotherapy, working across elite sport and building a nationwide physio business before co-founding EQL. Now through their Physio platform, EQL is helping people get faster access to the right care with intelligent digital triage and innovative solutions that support patients, clinicians, and healthcare systems alike. So Peter, welcome to the show. Thank you so much for joining us today.
Thank you, Andrew. Yeah, it's a pleasure to be here and looking forward to chatting.
So maybe you could just start a little bit about your journey and how you've ended up doing what you do at EQL. Where have you sort of come from and where you're sort of sitting now?
Yeah, thank you. Well, you did a great job, by the way, of doing the introduction. So, but just to add a bit more context, yeah, I mean, I'm a physiotherapist by background. As you point out, I started in elite sport, so I was very lucky. I always wanted to be that physio that ran on the pitch with the magic sponge, and thankfully, I was able to fulfill that dream quite early on in my career. So I worked for a number of years for a football club. We were in Premiership football, and I was super spoiled in that environment in terms of healthcare provision. And I didn't know it at the time, but I learned a lot about, the impact of healthcare, specifically when you can sort of observe somebody getting injured, which is not something that typically happens in the private sector, and then be part of their recovery and be able to really control the variables of that recovery. And that was something that really only sort of dawned on me when I left that setting. But yeah, I spent a number of years there, and then I went on to set up a private physiotherapy business. I ran that for about 10 years. I exited that company into a digital health business, and I spent a number of years working on what was kind of the start of the virtual GP kind of offerings, building out these digital platforms for GPs to be able to do consultations remotely. And it was during that period of time that I was really interested thinking about the problems that existed in that. I mean, in healthcare generally, but specifically in my area of expertise, which was MSK. And again, really wanting to get back to that kind of environment where, if you can get somebody into a pathway, into a recovery pathway or treatment pathway really quickly, how much of an impact can you have on their overall kind of health outcome as it relates to recovering from that injury? And the answer is you can have a dramatic effect if you get somebody early into a pathway, control the variables. You can do a lot to improve the recovery time and the overall outcome. And that's kind of where this idea for what we call Physio came from. So yeah, that's to give a bit of context in the background.
So what were those moments of inspiration that made you change and do those different things? Starting off in physiotherapy, what was that thing that's saying, okay, I need to do something else, or I want to do something else? And then again, when you've moved to the latest thing, what were those sort of moments of inspiration or the triggers to change direction?
Yeah, I think the main one was just the frustration of seeing like the inefficiency in the service, and the inefficiency wasn't there for want of trying. It's like everyone's trying their hardest to see the right patients and to do the right thing by their patients. But inevitably, capacity issues, funding issues quite often are at play, and a whole range of other things when it comes to health, literacy and understanding what sort of things you need to do. So I think, personally, it was born out of frustration because I'd come from a world where, we would, see someone have an injury and we'd say, well, in 4 weeks time, you're back on the pitch. And we pretty much guarantee that in that sector. And that was just normal business, and then moving out of that sector into the private space where, okay, private space, you would assume that people, there's more access to healthcare potentially. But even then it's like, why do these things take months in this sector? And what is that all about? And for me, it was about, quite often people sit around with injuries, not really knowing what to do, where to go, who to speak to. Then they do try and do something about it. And inevitably they have 5-6 different conversations about the same thing. Every time there's a bit of a delay. And then eventually you get to see someone and you're told, a lot of time in my industry or in the MSK sector, it's like, okay, here are some things you can do at home, go home and get on with them. And so I was just obsessed with this idea that why does it take, months potentially to get to the point where someone just says, here's some stuff, go home and get on with it. why, is there a way that we can use technology to improve the time to value metric in terms of getting them that advice straight away and getting back to this kind of ideology of like, you give someone the right tools to kind of help themselves, and can you get them to be better, quicker, back at work quicker, doing the things they love. So that, I think for me, a lot of it came out of that sort of frustration, and then the realization that actually so much of that process is kind of unlocked through this exchange of data, health data. And if you can create a sort of scenario where you allow this seamless interaction of this kind of health data, can you go some way down the road of realizing that vision. So I think fundamentally that's where the kind of motivation came from.
That's really interesting. So tell us a bit about the nitty-gritty of EQL and the platform, and how you solve these problems that frustrated you from the outset.
Yeah, so Equal, it's a bit of a play on the old kind of database language SQL, and we were being a tech business thinking of a way to kind of be clever about that. The idea behind Equal was, as I say, was to balance out the playing field on this data, like make the exchange of information kind of on an equal level across kind of all stakeholders, clinicians and patients. So what we started to think about was, okay, well, where's the bottleneck? And the bottleneck is in that initial process of A, understanding that you've got a problem, and then B, being able to do something about it, right? And so we started to explore the kind of entry points, which are typically a triaging process. You either call someone, or you have an appointment with a GP, or you go face to face to an appointment. There's an element of triaging going on where the clinician's taking information. Typically that's generic, standardized information. They're then using kind of various prediction rules to be able to say, oh, based on X, Y, Z, the pathway for you is to go to A&E, or the pathway for you is some exercises, for example. And we just started to look at that from a kind of very, sort of data-led perspective of, okay, well, there are certain questions which are standardized. There are certain outcomes which are pathways which are very well defined by people like NICE or by evidence. And so why can't we start to build a system that effectively replicates that kind of triage initial assessment piece in a standardized way, which is safe, reliable, there's no barriers in terms of access, and technology lends itself very well to that situation. And that's kind of where the journey started for us, was, okay, well, we'll develop this kind of digital triage piece, which is, yes, still overseen and has an element of governance, which is still physically kind of implemented. And that's always been very important for us to use technology to augment, but not to replace. And that's kind of how it started to develop. So we developed our triaging platform, and then we subsequently started to bolt in other pieces of the journey. So developed a supported self-management solution, which is a downloadable app for people who are appropriate and who are willing to engage in kind of home-based recovery, which is still very much overseen by our clinical team in the back end. And then started to kind of bolt in other bits, outcome measure collection, and if someone needs a face-to-face appointment, what happens, and just start to use the technology to really kind of fill the gaps and improve the user journey across that sort of whole continuum of care.
Really interesting. So what shifts are you seeing more widely in musculoskeletal care? Obviously you have a role, you're trying to solve a problem, but in the wider world of musculoskeletal care, what are you seeing?
Yeah, I mean, the big one for me is always this, talk about how the frustrations kind of created the initial drive. But still, I've got a huge amount of frustration around healthcare generally, actually, about this need for it to always be reactive. And why is healthcare always just a reactive thing? And can we shift the needle to a situation where it's less of a reactive service, it's more of a proactive experience for the individual? And so what does that look like? Well, for us, that looks like, prevention. Like, how do we crack the nut of prevention and mitigating the costs, the unnecessary, burdens, the unnecessary pain and discomfort and being out of work and all these things? Like, how can we shift the needle to a situation where we can proactively start to manage somebody's health before they start to need to consume a healthcare service. And so that's certainly where our vision is. I mean, more generally in the sector, technology is still playing a big part in disrupting the sector, be that, intelligent triaging, or be that, motion capture, or be that, the use of language models and AI. But I think there's still, despite all of that, it's like, for us, it's like, where are the problems still? What are the problems that we still need to solve? And inevitably they still revolve around access and, safety and being able to get help when you need it. And let's say being able to move the needle to one which is more of a preventative kind of scenario. So that's how we are kind of looking at it at the moment.
Thank you. And what about payer and provider expectations? How are those evolving? I don't know how it quite works with the funding in your model, but just curious to know where we're at with those kind of interactions.
Yeah. So again, we've historically, being a reactive service, healthcare generally, still predominantly in this sort of transactional kind of commercial arrangements where you pay for a service effectively. I see you 5 times, I send your insurer 5 bills for treatment. We don't like that model because we think it's it's prohibitive on a full population kind of coverage scenario. So the reason I say that is because people aren't necessarily incentivized to do the best thing for the patient in an efficient way and make that available to everyone. And our ethos is, we should build solutions that are available for everyone where appropriate and should not be cost prohibitive to the payer. And so we are kind of moving the needle in some respects to be able to say, well, we have a commercial model which is a kind of unlimited access for anyone that needs it. And where we want to take that is more to a kind of value-based model where we say, not only can we provide on a single price point access for everyone within the kind of agreement that we have, say it's an insurance company or say it's an ICB, we're saying, look, everyone in the area can access our tools on a fixed price point for you, so it's contained cost. Not only that, where we want to be able to get to is to say we can absolutely prove the value on that. And we can demonstrate that we are providing value across the full kind of care continuum. So this moving much more towards this kind of value-based model, where we kind of hold ourselves to account, expose all of the data and demonstrate value across the full kind of care continuum. So that's, for us, that's kind of that's where we're aiming to kind of get to, because I think then we do really crack that equity piece and inclusivity piece, and we are able to really make sure that everyone gets the care that they need in an efficient and safe way.
Thank you. Just for clarity, who are your clients? Are these actually insurers, employers, or individuals? How does it actually work at that level?
Yeah, so we are, our clients are the payers, the healthcare payers. So we're exclusively to business, B2B, B2B to C though, because we are trying to solve the problem for the individual user. But yeah, it's the healthcare payer. So we ideally go at system level. So we might go to the to the NHS and an ICB kind of level, ICS level, or where we're not in at that point. It's, can we cover a full kind of area for a GP or for a PCN, for example, and in the private space, it's to insurance companies, to cash plan providers, direct to corporates. Also, we have some engagements where we're covering a full workforce. So yeah, typically it's to the payer, because I think that way we're all aligned on what needs to be done. Like if the payer is getting full kind of coverage at a good a reliable coverage on good commercial terms, we are holding ourselves to account to make sure that we're putting the patient into the right pathway, and we're making sure that they're in the right pathway because it's in our interest. We're covering the full kind of cost of their care. Then actually we're aligned with the patient, with the payer. Like, we have this nice trifecta effect of kind of all being in the same kind of all having the same intentions in terms of delivering good quality, high volume, high safe healthcare. So yeah, that's, to answer your question, it's direct to payers. We don't have a B2C proposition. So yeah, that's how the commercials work.
Thank you for that clarification. And what are your enterprise buyers, whether the insurers, the employers, asking for in 2025 that they weren't 2 years ago?
So there are, again, we're in a bit of a unique position where, because we're to some extent selling novel ideas with some of these things, like we have a job also, a responsibility also to kind of educate the market to some extent about what we think is actually needed. So the reason I say that is because it's not always clear. There isn't always a clear mandate about what people necessarily want, but they look to us to bring the innovation to make sure that we're providing the best quality service. So that's the kind of backdrop. I mean, people are, depending on who they are, they're interested in our use of AI. They're interested in making sure that we are holding ourselves to account in terms of value, and increasingly, because of our efforts to try and drive the agenda of prevention, they're interested in how we can mitigate the MSK costs, whatever they may be, in terms of work absence, or in terms of return to work, or in terms of reduction of unnecessary kind of treatment costs. All the while making sure that we're delivering value to the individual patient, member, policyholder. So yeah, it's about continuing to improve member experience or patient experience, but also being able to do that in an increasingly efficient way, whilst also evidencing that it works for everyone. So that's kind of those are the highlights. But obviously, there's a lot of attention at the moment about how people are using AI and to what extent AI can answer questions here. And so certainly that's something which there's a lot of noise about at the moment.
Thank you. So I guess you're always refining your model, but how is the way that your model works at the moment, or the way that you're trying to shape it, affecting the way that you're trying to grow your business and to get more partnerships?
Yeah, I think absolutely we're always working on it. There's this thing about product market fit that people talk about. I don't think product market fit is something that you ever just achieve. I think it's something that you kind of, at a point in time, you may have it for certain things, but you're constantly pushing the needle out. And there's this idea of Moore's law, right? Where, every 18 months, the expectations of users doubles. And there are other examples, obviously, technology wise, around how that works. So I think ever increasing expectations from users generally, and our kind of mantra is, if we get happy patients, happy users, and that normally translates to good health outcomes. And then as a result, happy payers. So in terms of the refinement, there's a constant process of us looking at data, quantitative, qualitative, testing our assumptions in terms of new things that we might be bringing online, constantly evolving the way that the back-end system works in terms of, is there new evidence? Are there things that we've learned from our own kind of sort of data sources? And so there's this constant process of refinement, improvement. I say we're in a good position. I don't know if it's a unique position, but it's our position certainly, where we're never going to be a company that just switches off clinical kind of oversight. Like, there are companies out there that categorically draw a line in the sand and say, we are never going to be using clinicians. Like, we are just an AI business that does healthcare, for example. We're not going to do that. We always feel that the clinician in the loop is key. And I think that, that enables us to continually refine, validate the models that we may be using. And it's just a constant process of learning and updating. I think there has been some changes in terms of understanding literature. There's a big thing about bias in healthcare as well, where literature historically is very biased towards certain demographics or certain kind of users, and so we're constantly testing our assumptions about how we mitigate for things like bias in data. And yeah, it's just a constantly evolving process that never really stops for us, in all honesty.
Thank you. So what are you most proud of at EQL right now? What's working really, really well? What do you go home at night and think, yes, I'm really happy with the way this is working out for you?
Yeah, so a couple of things, I think. I mean, so certainly historically some wins have been, there was this assumption when we first started that, we would have a certain user group where we would be very particular, in a certain age range or something. And that's typical for technology. They say our focus group is, young professionals or whatever it is. We never kind of subscribe to that necessarily. We genuinely want to be a solution that covers all angles. And so one of our initial first kind of big wins was that we were able to demonstrate that, like, we don't see any digital divide in terms of, things like socioeconomic or digital literacy or age range. Like, that's something that we're very proud of. I think in terms of other wins, our main value proposition is that we want to be able to enable people who can safely self-manage to be able to self-manage quickly. When we started, we were seeing circa 20-25% of people falling into that category. Some of our latest data suggests that up to 75% fall into that range now. And that's not people we're forcing into self-management. That's people that are safe and opting into self-management. So certainly one of our wins has just been the huge amount of people that we seem to be unlocking in terms of being able to enable them to safely self-manage without necessarily needing to go into the health system. So that's certainly been a big win. And then I think maybe just in terms of overall volume, I mean, we cover a huge population now. We're in the predominantly in the UK, but also we're live in Australia, in the Australian market. We're doing something like 25,000 assessments a month through our platform, which is, significant. And so certainly that's been a big milestone and something that we're obviously really proud of, to have been able to have got to that sort of point. So yeah, I think lots of wins for us, lots of things we need to still work on, but certainly some good kind of some good medals along the way.
Really impressive. Super impressed. By contrast, what are the kind of the challenges or bottlenecks that are most impactful in the business today? I mean, is there anything around regulation or resourcing, integrations, procurement? What are those things that are bothering you?
Yeah, I think you've just mentioned them all, right? I mean, regulation is not a bottleneck, but it's certainly something that you have to be across, and you have to be many, many, many steps ahead. And we actually take the view that we like to engage, with the regulator in terms of not only domestically but internationally. I mean, we set up a focus group with the WHO that was looking at as part of the AI for Health focus group that was specifically looking at MSK for mainly for this reason. Like, how can we safely use AI in our sector, because it's something that's going to happen. So I think that keeping abreast of the regulations is very, very key. User expectations, as I say, they double continuously. So you can have a product that's in the market, a year or 2 years ago. Like, the expectations of users nowadays, particularly when it comes to things like chatbot technology, because the advent of ChatGPT and the others, just the expectations of users is just so much higher now, which is a good thing, and it drives us forward. So meeting expectations for users. But then you mentioned others, funding, not funding, but maybe internal resource is always constantly under pressure, because we're constantly building and developing new ideas and new technologies, and each one of those new projects requires more people, and so we have to be very effective and efficient with our time resource. And funding is difficult, especially in the NHS. Funding is difficult, especially at the moment. There's a lot of questions rightly being asked about, the spending of money, and being able to evidence that, and being able to create, viable business cases that are complementary to our NHS customers is a challenge. It's not like in other sectors, in other parts of the world, where maybe there's much more significant funding at hand. In the UK, funding is very tight in the public sector. So we have to work hard to prove our value, and that's a constant thing, because inevitably people want things to get cheaper, more effective, more efficient, and so we have to deliver on that in order to be able to not only keep our lights on, but also be able to keep the lights on generally with the NHS and our NHS customers. So yeah, there's constant things that we're trying to manage there, which at the end of the day is business, right? And it's what keeps us honest also in terms of our development. So it's all part of the fun and games, I suppose.
And on that note, if you had a magic wand and you could fix one thing in the business tomorrow, what would that be?
Yeah, I mean, I'm a stickler for efficiency. So I mean, I think partly the reason that I sort of ended up going, we ended up going down this route was because I was just frustrated with the inefficiency of, like, the amount of conversations people had to have and the amount of times they had to say the same thing and whatever. And so I always still look at our operation and think, not just our operation, our technology, where can we squeeze out more efficiency in the things that we're doing? So I think that's always a constant thing, is like, can we do things quicker, more effective, whilst maintaining the safety and all of that sort of stuff? I think yes, we can. And really the only other one is, as I said, I would love to be able to really deploy and realize the full potential of our preventative kind of medicine. And so that's a big motivation for me currently, is solving that problem.
And if you were starting EQL again tomorrow, would you do anything differently? Obviously, bearing in mind the journey that you've had so far.
Yeah, it's a great question. And it's obviously one that comes up, sometimes in these discussions. I think I'm a firm believer that everything just is, I don't get too hung up on mistakes that were made. Like we make mistakes. Like there are things that are oversights. Aside from the obvious, making sure everything is very safe and all of that, like there are things that you do where you think, well, that, we pushed that out too quick, or we didn't quite understand that market, or I think that you learn from that, in all honesty. Like I think would I change anything? I don't think I would change anything, because I'm a firm believer that when you've made a mistake, it's normal, it's natural. I'm wary of people that say we haven't made any mistakes, to be honest, because I just think, well, then you either haven't tried hard enough, or you've been ignorant to mistakes that you may have made. So I don't think there's anything I would change. I think, when people ask me for advice on particularly early stage business, I think you have to understand, number one, you have to be a user of your product. You have to really understand the product from a user's perspective. That's rule number one. But once you've done that, you absolutely have to be conscious of the fact that you are now the most biased user of your product. And you then have to challenge the assumptions that you've made about how it works and what it does and what value it adds. So it's less of a lesson. It's less about of a cautionary tale, more of a kind of, my advice generally is always just make sure you do that. Like, make sure you have a product that you think solves a genuine problem. Sounds obvious, but not everyone does. Like, some people start businesses purely to make money. And I think that's an oversight, in all honesty. I think it's like, yes, it needs to make money, but you have to see you have to know the problem, really. And then I think very quickly you have to check yourself and the assumptions that you've made. And the quicker you can do that, the quicker your product is going to be, out in the market doing good things, solving real problems.
Thank you. If you had a sudden influx of new partners or new service users tomorrow, would anything break in your platform or your service?
So in terms of, things like capacity and all that sort of stuff, like, technology is obviously very good at being able to scale quickly. And so from that side, no. We do have an element of human capital requirements for growth, as any business would. But in all honesty, we have a very efficient engine internally, and we have a very good model in terms of things like staff retention and recruitment, actually, if we need to bring more people on. So no is the answer. But that said, it's like, of course, there's the risk there's the risk of any business in terms of overtrading, and you have to be cognizant and cautious of, it sounds like a champagne problem sometimes to have loads and loads and loads and loads and loads of work coming in, but you do have to obviously tread carefully. You can overtrade if you're not careful, and it's just about doing things in an efficient, safe way. And it's about understanding all of the failure points way ahead of time so that you can predict, never be surprised, basically, about things that could happen. So yeah, growth, absolutely. We are supercharged and primed for growth. We've been doubling, year on year for the last 7 years anyway, in terms of 100% year on year growth. So I think we're doing a good job of that growth. I think we are conscious of the things that need to be improved in order to continue that at that sort of rate. And I think so long as you have a handle on those things, like, you're in a good place. As long as you understand the limitations, you don't get complacent, you have good comms internally, externally with your investment and all these sorts of things. Like you can manage that as long as you understand it, as long as you're being sensible about the limitations, and as I say, you're not being surprised by things that suddenly pop up out of the blue.
Thank you. So obviously EQL is a business. Are there any particular metrics that you are particularly interested in the day-to-day operations to kind of keep an eye on how things are going and where things are going?
Yeah, I think obviously, the obvious ones around, performance of the tools from a safety perspective, from an accuracy perspective, and also from a value perspective. And then aside from that, obviously, there are commercial things, it's like managing your runway. It's like making sure there's enough in your pipeline, understanding the conversion rates of potential new customers so that you can manage all of these things like the growth and the forecasting and the resource and the tooling that you're developing. So there's no one single thing that you have to be across. I think you have to be across all of these different things in order to have a business which you can safely say is sustainable and has long-term future proof. So I think those are the main things. I never get stuck in. I'm always 6 months, 12 months ahead in terms of things that could go wrong, things that we are probably know are coming in terms of improvements that need to be made or technology that might be available or expectations. So I think so long as you're not getting complacent and you're constantly looking ahead, then you can't go far wrong. That said, there are clear commercial things that you need to make sure you're fulfilling, right? Like you need to be sustainable, or you need to at least have sustainable growth, or you need to have a good runway in order to fund, the growth that you're seeing. So yeah, I would say those are the kind of things that at least keep me up at night.
Thank you. And where do you think, where is EQL going in the next 6 to 12 months, whether it be around product, partnerships, geography, or anything else?
Yeah, well, I'd say we've got pretty aggressive kind of growth expectations in Australia. That's a big market for us, we think. We constantly play with this idea of going into the US market, and I think every day we get slightly closer to that being a reality. It's just a cautionary tale there because there's many health tech businesses that go to the US and fall apart. So we have to be cognizant of that. We've got some super interesting stuff coming up technology wise in the next 12 months. So I'm very excited about the next phase of our product development. We've got some really interesting things coming out on our triage, and we're developing these kind of digital twin ideas, which we think is going to be really cool and a step forward in that sort of precision medicine approach, specifically as it relates to our preventative stuff. So I'm super excited about that. I think we're on course to do another 100% year in terms of growth. But look, it gets big. There's certainly an inflection point. Like I took a business from 2 employees to 72 employees, and I understand in a previous life, I understand the inflection point around that 30-40 people. It's massive to double your business at that size. Like it may only be double the amount of revenue maybe, but the people requirements, the management setup, the layers of HR support is significant, going from that, from one area to sort of doubling the person count. And so, I'm also cognizant of what needs to happen there. And I know that's going to be a big, that's a big undertaking for us. And that's the trajectory that we're on. So, lots of things to still be thinking about, but super excited about the technology and where we're going with it.
Amazing. Got to ask you, do you miss being able to rush out onto the pitch with a wet sponge? Were you harboring this sort of secret knowledge of tech and business all these years while being clinical? Because I'm fascinated as to how you've made this kind of transition and where you've ended up today. It's fascinating.
Yeah, I don't miss it, is the honest truth. I loved it at the time, but it's I think I've sort of since, I've moved on and I'm comfortable where I am now doing what I'm doing. It's interesting. I think a lot of it did harbour back to those days in that elite sport environment, because we used to sign players and we'd have like we'd have a screening system that, you know, would basically use data. Like we'd get people jumping up and down, running up and down, and we'd be like, right, based on the outcomes here, like we shouldn't sign you, or we should sign you, you know. And it's like, again, I just became really obsessed with that idea that it's just comes down to data, and so a lot of it I think stems from those days. But no, I don't miss it. I love what I do now because it's super interesting. Like we're at the, you know, we really are at the kind of sharp edge of innovation and kind of clinical, you know, practice, and that's really interesting to me. And yeah, I think, where did it come from? Yeah, it certainly came from just this kind of inquisitive mind of, you know, how do we solve the puzzle here that is healthcare? And it's a big puzzle to solve. And, you know, I think once you start to see that there's a path through, and you start to, you know, be able to kind of demonstrate some value with what you're doing, like that's, for me, that's massively motivating, and it just keeps me wanting to do more and more, you know.
Amazing. Peter, on that note, thank you so much for the conversation. It's been really, really fascinating, really interesting hearing about under the bonnet at EQL, the work you're doing, and how you're scaling MSK care while keeping quality at the centre. Quite brilliant. Thank you so much for your time.
Thank you, Andrew.